My name is Marty Makary. I'm a surgeon at Johns Hopkins Hospital and a professor of health policy at the Johns Hopkins Bloomberg School of Public Health. The World Health Organization has identified antibiotic resistance as the #1 public health threat of the future. They're talking about superbugs. They're talking about bacteria that become smart and learn to become resistant through mutations to antibiotics that are commonly used to kill those bacteria. It is tragic to be able to be in a situation where you look at a patient and say, you have an infection, there are no more antibiotics left that we can use that this infection would respond to. This infection is resistant to everything we have. And having been in that situation, it makes you angry. It makes you wonder, how did we get to this point where the careless overuse of antibiotics has contributed to people actually having infections now where we cannot treat them? Nobody looks at the overall implications of a single overuse administration of antibiotics. But when you look at things in totality, we have created this massive public health problem that affects children, it affects people that are vulnerable, people that are immunosuppressed, older patients. These populations are disproportionately affected. And it's about 20% now of all the antimicrobial resistant infections that we see in the hospital probably originated from agriculture and from the overuse of antibiotics in agriculture. Look, we doctors did a very good job trying to educate the public about smoking. And we took this on as a profession. We as a profession should take on the cause of not using antibiotics routinely in agriculture. It's bad for public health, it's bad for antimicrobial resistance, and it's also just poor practices. This is a real key time. I think policymakers, the food industry, needs to respond to this public health threat